Tell me when.
Going.
Alright. The temporal mandibular joint in the adult is a bilateral diarthrosis between the articular eminence of the temporal bones and the condyles of the mandible. The temporal components of the TMJ are an articular arrow, located slightly anterior and superior to the condylar head of the mandible, and an articular fossa.
Articular eminence?
Correct.
Alright.
Between the two convex articular surfaces of a biconcave articular disc is present. Okay. The entire joint is surrounded by a fibrous capsule, which is particularly strong at the lateral border. The temporal mandibular ligament. Two synovial cavities are formed between the disc and the articulating surface within the capsule. These cavities are lined with a synovial membrane, which is folded into villi at the anterior and posterior borders. The synovial membrane is engaged in the production of a viscous synovial fluid, serving as a lubricating and nourishing fluid for the joint. A highly vascular retrodiscal area is located posterior to the relatively avascular disc. Note the lateral pterygoid muscle anterior to the joint and part of the parotid gland posterior to the joint. Hematoxylin in the units stay. Okay. Articular tubercle in adult sagittal section times 25. And that previous one was a TMJ joint adult 27 years sagittal section. Okay, so articular tubercle. Unlike most joints in the body, where the articular surface consists of hyaline cartilage, the joint surfaces of the TMJ are covered with a very dense fibrous tissue. Since the posterior slope of the articular tubercle is one of the articulating surfaces of the TMJ, a thick layer of relatively avascular fibrous tissue covers its surface. Some of this tissue may turn into fibrocartilage, as is evident in the deeper layers adjacent to the bone. This compact lamellar bone supports the fibrocartilage and fibrous connective tissue. Hematoxylin mucin. Slide 27, articular fossa in adult sagittal section. The structure of the articular fossa indicates that this area of bone is not involved in functional articulation. A thin layer of periosteum covers this extremely thin plate of bone, which merely serves to separate the joint from the overlying middle cranial fossa. There is evidence, resting lines, that some remodeling has taken place in this bone. An arrow indicates the superior joint cavity. Period. Alright. Slide 28. Condylar head in adult sagittal section. The articular surface of the condylar head is covered with a dense fibrous tissue, which may with age turn into fibrocartilage. This tissue covers the remnants of the hyaline cartilage from the earlier stages. A reserved cell zone of cartilage is not present any longer, and this lower surface is closed off by a compact layer of bone, indicating that no further growth is taking place in this area. Growth in mandibular condyles generally ceases with adulthood. Minor bone remodeling of the condyle may take place throughout life. Hematoxylin mucin. Alright. Slide 29. Articular disc in adult sagittal section. The disc of the temporal mandibular joint consists of dense fibrous connective tissue, which may turn into fibrocartilage with age. The disc is relatively avascular, especially in the thin central region. In the central part of the disc, the fibers run parallel to the surface. The peripheral parts depicted on the slide, the superficial fibers also run parallel to the surface, while the deeper fibers form a densely woven feltwork. Densely woven feltwork. Yeah, that's it.